will depend on the primary healthcare system of a given country. And in the primary healthcare system, the main stakeholder in provision of service is the midwife. So it's very timely because the countries are expected to achieve the sustainable development goals by 2030. So the second strategic development, what we are going to do for the is the next, which are now going to be introduced in globally, were been explained, and also that today mainly we have discussed the achievement by country about the already existing strategic directions, and also the evening session that we have discussed about the content areas which have been covered in the new strategic direction document. And also that
Yes. Okay.
today
So it's
mainly
pretty
we have
great to
discussed
hear
the
that
achievement by
nursing and midwifery
country about the
specifically have been
already
recognized
existing
as
strategic
essential drivers
directions,
of
and
health
also
outcomes.
the
So,
evening session that we
uh,
have discussed
were
about
there
the
any
content areas which have
specification
been
points
covered in
or
the new
commitments made
strategic
by
direction
countries
document.
or
And
health leaders at the
yes,
meeting?
Okay.
today
So,
yes, actually,
it's
when
pretty great to
it
hear
was being
that
stated
nursing and
by the
midwifery
CRO that
specifically
the CRO
have been
is the
recognized as
first
essential drivers
region
of health
to
outcomes.
achieve
So,
the most of the
were there
SDGs,
any
at least the
specification
targeted
points or
SDGs
commitments made by countries or
so far.
health
That's one
leaders
thing.
at the meeting?
The other thing is
Yes,
that
actually, when
since
nursing
the
and midwifery
guidelines were
specifically
being
have
there
been
and the directions were being
as a
there from
region
the
to
CRO,
achieve
it
most of
will
the
give us the
SDGs,
country, give us
specification
the
points or
uh,
commitments made by
the
countries or health
directions
leaders
so
at the
that
meeting.
how to identify the
Especially when
existing gaps
it comes to nursing
in
and
achieving the
midwifery
SDGs and
specifically,
how to address
they
those
have
ones.
Okay. So you have mentioned that midwives play a vital role in achieving maternal care goals. Can you elaborate on how they are uniquely positioned to drive this role forward?
Yes, actually, the midwife is considered as the primary, the main stakeholder
Okay.
in provision of
So you
primary
have
healthcare in a given
mentioned that
country. And where the countries
midwives
that
play a
they do
vital
not have
role
the
in
midwives,
achieving
instead of
maternal
that, that they
care
do have the
goals.
nurse
Can you
midwives.
elaborate on
So
how they are
that's
uniquely
how the it's the that particular stakeholders are coming into the scene. And primary healthcare setting is at the grassroots level, and sometimes they are the only care provider in a given setting. In some countries there is no any other one, so that having a good professional person in the community level, it will give the confidence to the community to turn to them whenever they are having health issues, and especially the maternal care one.
Yes, that makes a lot of sense. With nurses and especially midwives being such a large part of the health workforce, it's clear that they have a unique opportunity to create change at the grassroots level.
Yes.
Okay, so as we all know, every opportunities comes with challenges. What are some of the challenges for nurses and midwives specifically uh, face in leading UHC and SDG progress in your country?
Yeah, actually, one is that the number of persons being in the service, because it has to be the grassroots level when they are in the service provision. It has to be a number of their target population has to be reachable for them, so that the human resources, adequate number of human resources at the grassroots level is a must for us to have it. The next one is to have their technical capacity and the professionally to manage those ones. So that means continuous professional development has to be taken place to keep the standards. So those are the main two challenges we are facing at the moment. But anyway, the government is addressing it, because in Sri Lanka we have recruited 2,000 midwives for the training, and already 1,000 is there
Oh,
waiting to get the placement, and other 1,000 is undergoing the training.
Okay, and what is there any solutions already, or like what solutions were proposed at the meeting to address these challenges?
Yes, actually, most of these were being identified even already by the even at the regional level. And also the one thing that was being mentioned is the midwifery service in the private sector, because most of the time that it has been discussing about so far, even the previous ones are about the government level service provision. But we know that in some other countries that not all the countries are having the private sector as well. So now it's high time to get engaged those ones and to integrate it into the strategic plans, also to ensure that the quality and the standards are maintained in provision of the services at that sector as well. So that was being discussed today during the today's discussion.
I always like to ask this question. If you could ever offer one key message to midwives health in healthcare, or it's all around, maybe especially in your country right now, what would it be?
Yeah, one thing is always it to be the patient-centered or the client-centered service, because that is uh, the goal that has to be there for a midwife, or for that matter for any health professional person.
Yes.
Because patient-centered care or the client-centered care means we are addressing their needs. We, the health professionals, are there to address the needs of the people who are seeking the care. So that is the, I think, always has to be there with the health professional person when they are providing the service. Yes, that's it.
That's a powerful message. I hope our listeners feel inspired to take action in their own communities and institutions.
Okay, so we're at the end of our podcast episode, and before we wrap up, maybe you can tell us where can our listeners follow your work or maybe learn more about the outcomes of this regional meeting?
Yes, actually, I think that all of you all that who are listening to this in this region has to be proud of your own country health systems, because the ones that who are in the health system are devoted their time and their energy to achieve all these things. Achievement of these goals means the achievement for the community and the public in the country. So that please use the services available and to have a good health and healthy families and healthy communities. So it will depend on the extent that you use your health system in your country. Yeah, that's it.
Okay. Thank you so much, Doctor, for sharing your insight on the critical role of nursing and midwifery in achieving universal health coverage and sustainable development goals. I hope this conversation has inspired our listeners to see healthcare leadership in new light. Okay. So if you enjoyed this episode, be sure to follow our YouTube account and stay tuned for more discussion with health leaders from around the world. Until next time, stay informed, stay inspired, and keep pushing for a healthier, more equitable world. Thank you so much.
Thank you. Thank you, George. Thank you. Take this.